Thanks for joining Zenesis Technologies live webinar on accelerating the COVID-19 response with big data and advanced analytics. My name is Tenley Snow. I'm Zenesis Director of Strategic Communications based in the United States. I'd like to take a moment to introduce our speakers today and review the agenda. You should already be muted, but please continue to remain on mute throughout the call, and there will be plenty of time for Q&A following our discussion. So in addition to serving as our Global Director for Emergency Response, Walter leads strategy at Zenesis, including with international organizations and our global staff in 10 countries. Walter has helped start Zenesis implementations in 7 countries, including in Africa and South Asia, and he's also an advisor at the Asian Development Bank. Walter is also a former US diplomat, having served 7 years as a political and public affairs officer at US embassies and consulates in China, Taiwan, and Brazil. Zenesis Director of Implementation Excellence, Claire works with all of our project teams to ensure that our implementations are consistent with our values of excellence and user-centeredness. Claire received undergraduate trainings at Johns Hopkins and Sciences Po in Paris and is currently pursuing an MPH in epidemiology at the Harvard Chan School of Public Health. Claire also completed a Fulbright research grant in Malaysia and has collaborated with implementers and researchers across the private and public sector, including JPIGO, Apt Associates, the Broad Institute, the Rainforest Alliance, the Bloomberg School of Public Health, and the Yale School of Public Health. Based in South Africa, Safa is the Southern Africa Regional Project Lead at Zenesis. Safa leads our South African projects in partnership with Global Fund implementers such as NACOSA, AFSA, and Beyond Zero. And he also supports projects in partnership with in-country governments in Zambia, Mozambique, and Pakistan. Safa holds 2 master's degrees in biomedical engineering and healthcare technology entrepreneurship, as well as a Bachelor of Science in mechanical engineering. So I'd like to share a brief overview of Zenesis Technologies today, where and how we work, as well as a short demonstration of our technology and our capabilities. We'll also discuss our prior experience enabling efficient emergency response in Mozambique. And finally, we'll discuss the present COVID-19 pandemic and the need for a coordinated and data-driven response as country strategies rapidly evolve. Just a note, I will be monitoring the chat throughout the presentation, so please share your questions there, and they'll be addressed during Q&A toward the end of the call, and we should have some time for some verbal Q&A as well. So Walter, over to you.
Well, thank you, Tenley. So for those of you who are who've not heard of Zenesis or don't know me, my name is Walter Kerr, and I'm the Global Director for Emergency Response at Zenesis. And right now, the company works in more than 10 countries around the world. And we work with a mix of both directly with ministries of health as well as through implementers that work often on behalf of and with ministries of health and other government agencies as well. The big problem that we help governments solve in routine times as well as in emergency times is figuring out very complex information management when you've got a lot of different fragmented information systems. And this is something that we see a lot of during emergency times especially. And what I mean by that is that often in both routine times as well as in emergency times, what we see is this proliferation of different information sources. And I'm sure for those of you on this webinar today, this is a problem that's all too familiar to many of you, which is to say that there might be EMR and patient level data collection tools. There might be web apps. There might be supply chain systems. There's DHIS2 modules. There's often dozens and dozens of Excel spreadsheets sitting in different program areas and with different implementers and with different government ministries. There's often additional data as well that can be useful in terms of coordinating a response that are not necessarily the traditional kinds of data that we think of for health use cases. So for example, if we're trying to think about contact tracing, for example, there's airline manifest data, there's customs and immigration data, there's ride-hailing app data. And every single data source that I just described is sitting in its own separate location. Often every single data source is captured according to its own standards. Some data might be collected and reported every day. Some might be reported and collected every hour, every month, every week. Sometimes we're dealing with survey data, which might be reported once a year, once every 5 years. If it's some of the routine demographic surveys that are performed every few years in the countries where we work. And in addition to just the period, the time and the frequency of reporting, there's also different granularities of reporting. Sometimes we have data that goes down to the individual level, sometimes to the facility level, to the municipality level, to the regional level. The indicator names across different systems will vary, especially when we're dealing in countries that are using multiple languages. So you might have some indicators in English, others in French, others in Portuguese and Spanish. It really kind of varies depending on the use case in the country, but this is a pretty common problem that we see, is just the multitude of ways in which different data systems are different. And this is not even to mention the different types of software the data systems sit in a mix of open source systems, and we're seeing more and more of that, and that's great. But there's still also a lot of proprietary data systems out there, Excel-based systems, et cetera. And what decision makers ultimately need is the ability to bring in together all of these different information systems into one unified location, into one unified workspace, so they can have global visibility into what's happening in terms of emergency response. And that's essentially the problem that we help solve. And so what we do is we take all of these different information sources I just mentioned, we build a layer that allows you to pull the data from these systems. And we do that via APIs, sometimes via direct database access, and sometimes via uploads directly into the platform. And it goes through this processing step, which is what we really specialize in building, that allows you to very quickly, and when I say quickly, I mean often we can integrate the initial data sources within 24 to 48 hours of getting data access, so that then it can be eventually output and visualized in our Zenesys tools. And today I'm going to show you our open source Harmony tool, or can be visualized in third-party tools, such as Tableau or Power BI or any of the other variety of visualization tools that are out there. There are a few things that I want to mention just before I get into an actual demonstration of the product, and then I want to chat with some of my colleagues about how it's being used today, both in the context of COVID as well as other emergencies. The things that I want to mention are first that the tools that you're about to see are all open source. And what that means is that other third-party implementers can work with us to implement these tools. So if you are an implementer working with a government, working with an EOC, an Emergency Operations Center, working with the Ministry of Health, and you're confronted with this challenge where you have multiple web apps, maybe for contact tracing, and you've got multiple different information systems that are capturing data relative to the emergency response, and it's your job to be able to bring all of this into a virtual COVID-19 control room, we can work with you to help you bring these different systems together and ultimately present a platform to help ministries of health and EOCs achieve that goal. In many of the countries where we work, we can work directly inside of the Ministry of Health as well. This is a pretty typical use case. We work directly inside of ministries of health, EOCs, et cetera, and can help them very quickly. And when I say very quickly, I mean often between 24 to 48 hours, stand up the first virtual control room that's integrating data sources. But it also means on the back end of this, in terms of long-term country ownership and management of the system, because the tool Harmony, which I'm going to show today, is open source, it means that the long-term maintenance can also be done by third parties as well. And so we can talk about how that works at the later half of the Q&A if you're curious. But this is to say that what we are showing today is something that is meant to be a tool that is highly collaborative, that can be used by a variety of actors involved in the emergency response. And the other thing that I want to mention is that we have secured approximately $1 million in matching funds that we can use as in-kind support to support countries today in the COVID-19 response. And what that means is that we are processing requests on a first-come, first-served basis. If you visit our website, or actually if you go to our medium.com/Zenesys webpage, and we'll share the link at the end, there's a tab there that you can click that says work with us. And if you just provide us some basic information about the use case, we can get back to you about whether or not this is something where we can apply the matching funds. We have allocated already much of the funds for countries that have requested it, but there are still funds available. So please do make sure to do that. And we can talk one-on-one about how that works. I am going to show a demonstration of the platform, and then I want to turn the conversation over to my colleagues who can talk more about how the platform is being used today with regards to COVID and also in non-COVID times as well. And so what you're looking at right now is the open source platform Harmony that we've built and we made available last year, and actually, we're proud to say has been implemented by other implementing partners, including in sub-Saharan Africa. The first page that we're looking at here is kind of the home page where we can see the variety of dashboards that you can create, existing dashboards that you built, recent queries, but really the big magic happens here in the Analyze tool. And so what we're going to be interacting with today is data that's coming from the Open Brazilian data portal, DataSUS. And the Brazilian government has done a great job of making a lot of their data available to the public. And if for those of you who have ever interacted with it, though, these data sources are often stored on different web pages. And so what we've done is we've gone to the Open Data Portal, DataSUS, and we've performed an integration of those various fragmented data sets so that decision makers can actually interact with this in one via one view. So for example, if I click here on the Indicators tab, we can see the variety of different information sources that we've integrated. And when we actually click inside of the information sources, we can see all of the various indicators that are included within that information source. And so in the context of COVID-19, for example, you could imagine having a contact tracing application here. You can imagine having a supply chain management information system here, a logistics management information system here, some of your DHIS2 data and the various DHIS2 modules. Each one of these line items can refer to a specific data system, data source, and the specific indicators that are within it. The goal here, remember, is that all of these systems are presently sitting on different locations, and we want to be able to integrate that into one unified location so that decision makers can bring all of their indicators together. And so just to illustrate the point, what I'm going to show you here, and there's a variety of types of data. We can see there's financial data, there's death registry data, there is information about causes for hospital admissions, there's information about days spent in hospitals, etc. But if I wanted to run a query, for example, for pneumonia, and I wanted to see all of the indicators that exist within different systems as it relates to pneumonia, I can very quickly surface that information. And so, for example, we can see here information about where vaccines have been distributed. And by clicking on that particular indicator from that particular system, I've now grabbed the data from that system and we've aggregated it up to the national level. We can also look at data from the routine public health information systems on the number of hospital admissions as a result of pneumonia by choosing that indicator, the total number of deaths as a result of pneumonia, the total financial spend to treat pneumonia. And what we're looking at here is aggregate information that's aggregating up to the national level, but we can very quickly disaggregate this down and look at every municipality in the country if we want to. We can also add other data too. So if we wanted to look at municipality population information, so data that's coming in from surveys or census information can be brought into this as well. So what's interesting here, to me at least, is that we're looking at a number of systems that are reporting information regularly. They're routinely reporting information side by side with survey information as well. And then we can go and actually begin to filter the data as well. So what if we wanted to, we could say, you know what, I want to know what's going on just in Sao Paulo state, for example. And I want to know what happened in the last hour, in the last 4 hours, in the last day, in the last week, in the last year. And what we're trying to capacitate decision makers to do is to be able to be agnostic about the differences between the systems, how frequently they're collecting data, the level of granularity they go. Some systems might go down to the individual level, others might go to the facility level, and to enable you to very quickly slice and dice the data and even combine it in new ways. So for example, if we wanted to look at a mortality rate per 1,000, we could do that by choosing deaths divided by population times 1,000, and we can create this brand new indicator. We could also look at what is vaccine distribution per 1,000 look like by choosing vaccines divided by municipality population times 1,000. And we can create these two brand new indicators that are actually composites of indicators from different systems that presently can't see each other. Within each of the visualization tools, you can also go ahead and begin to manipulate them in different ways. I'm going to show you the variety of types of visualizations, not every single one of them in the interest of time, because we want to make sure that we have time for Q&A as well. But we can look at the information in this particular instance as a bar chart, for example. And the goal is to make as many of these visualizations as dynamic and as easy to interact with for decision makers as possible. So we can turn on and off different indicators as we're going through the visualizations. Right now, you can see I'm turning on and off various indicators, and we're able to surface very quickly new insights. So for example, if I wanted to look at the mortality rate indicator that I just created side by side with the vaccine distribution indicator, we can do that on demand and in this new visualization. So for example, we can see in some municipalities where we have very high mortality rates relative to other municipalities, and the relative proportion of vaccines that were distributed there. So for example, we can see in this particular municipality, there's appears to be a higher than average mortality rate, lower than average vaccine distribution. That may be an opportunity to improve vaccination coverage to bring down mortality rates. And we can really see this for every single municipality in the country. And every one of these visualizations can be sorted, filtered further. And so if we wanted to look at this geospatially as well, we could do that. So if we wanted to look at where there are clusters of pneumonia cases, and the reason, by the way, that I'm choosing pneumonia as an indicator is because often what we see is that bacterial pneumonia is commonly associated with very severe complications for COVID-19. But in many of the countries where we're working, we know that there are new tools and new systems coming out that have COVID-specific indicators as well. And as those new tools are coming out, we can very rapidly integrate those as well into the system. It's meant to be highly extensible, highly flexible, so that as new sources of data come out and as we move along the epi curve, you can integrate that information into the platform in a dynamic way. And so very quickly, if we wanted to look at this information in a geospatial format, we could very quickly see where do we have clusters of pneumonia cases forming. And if you could imagine right now in the COVID response, what we see is many partners going out, capturing information where I've got X number of COVID positive cases here, X number here, X number here, all within the same catchment area. What we can do is very quickly aggregate that across the different systems so that decision makers can see very clearly one number about the total number of cases of COVID or pneumonia or any other particular type of illness or indicator that they want to see. The very last thing I want to mention is that as it relates to visualizations, is that there's actually a whole suite of different visualization tools. We can look at it as a table view, bar charts, epi curves, heat tiles, ranking diagram. There's geospatial tools. There's a variety of data science tools. We're also not limited to integrating just the health data. We can also bring in a variety of other types of data sources that are relevant to the emergency response. This could be food security data, for example, agricultural data. We could bring in transportation information, Ministry of Finance data. Zenesis was built to be the operating system for governments. And so the idea here is not to just have this be a single sector response, but something that the government can use to coordinate its government-wide response. And any of these visualizations can be saved to dashboards on the fly, and dashboards that update in real time. So if we wanted to go to a specific pneumonia-related visual dashboard, we can see pre-built dashboards that can update in real time as the data refreshes and ingests into the system. And by the way, the one thing I want to mention about the dashboards themselves is that all of these dashboards can be made such that you can share them. You can make some of the dashboards public. You can make dashboards shareable within only certain subsets of teams. You can make other dashboards available to the public. And it's meant to be a tool to facilitate rapid information sharing. And then the very last thing, as far as the demo is concerned, is our data quality lab. One of the things that we want to be able to give decision makers the ability to do is to very quickly interpret the quality of the data that they're interacting with. And so we've built a data quality lab that takes into account various factors that WHO has identified to evaluate data quality. So we can look at things like reporting completeness, for a particular indicator. So right now we're looking at the pneumonia admissions indicator, and we can see, how well does this particular indicator score across states. We can see how well does it perform across different municipalities, across different facilities. And we're looking at things like indicator age, completeness trend, and time since last report, estimated reporting period, et cetera. So I'm gonna pass the baton here in just a moment. But before I do, I just want to mention a few other types of use cases that we typically solve. What I've just shown here is a lot of aggregate data, but we commonly interact with individual level data. And one of the most common use cases that we see is the need to be able to take multiple systems. So I've got system A, system B, system C. We might have an individual interact with those three different data systems. So you can imagine going to one site in an HIV use case, for example, one site for testing, one site for treatment, a third site for counseling. And we need to be able to make sure that that person continues along the continuum of care. But maybe their unique identifier was entered wrong across the different systems, or we've transposed some numbers when entering the unique identifier at the point of data collection. One of the most common use cases that will help implementers do is to stitch those systems together so that we can still monitor that person going through the continuum of care, which is useful for a program manager to be able to have that kind of operational insight to say, I need to follow up with this person because it appears they went for testing but did not follow up for treatment. But you can also then aggregate that information on a site-by-site basis so you can see how well are we achieving our 90-90-90 or 95-95-95 goals, for example. So a common use case we see is the need to interact with individual level data. And then also on top of that, to begin to do case management work. So now I've got I've got information about a particular individual in the system, and I need to go and follow up with them and enter additional data about that person. We have case management tools that we can talk about as well. These types of tools can be used for a variety of use cases. So we can supercharge contact tracing activities, for example. So if you've got multiple contact tracing activities happening by different providers, you can link those together so that you have the benefit of all contact tracing activities happening in one place. And we can bring in additional data like airplane manifests or immigration and customs records to help provide that additional extra health information to help them accelerate the speed at which they're able to do contact tracing. You can use this for supply chain management. I need to look at the health demand side by side with how many ventilators do I have available? How many PPE, personal protective equipment, do I have available at every single facility or every single site in the country? Because I've got this big new shipment coming in and I need to direct it in the most data-driven way. And then I showed you a little bit of the geospatial tools. You can do geospatial layering. So you can see where do I have clusters relative to where do I have inventory, for example. And then you can bring together a variety of different indicators together to look at things like workforce data or inventory data or health data, et cetera, to be able to generate very quick facility readiness assessments. And all of these visualizations and tools can be uploaded into dashboards that are very easy to create. It's really just a matter, you saw how quickly it was for me to generate those visualizations. It's really just a matter of then clicking add to dashboard, and then you've got a dashboard that you can use internally or share with the public. But before we go into questions and answers, I actually want to turn the floor over to one of my colleagues, Safa Naragi, our regional director for Africa, who was involved in standing up this tool in response to Cyclone Idai in partnership with the Mozambique National Institute of Health. And Safa, I thought that it would be interesting to hear from you about how did this approach to data integration ultimately inform the government's ability to respond to Cyclone Idai and then just a month later, Cyclone Kenneth. If you could chat a little bit about that and what the context was like at the time, I think that would be really instructive.
Definitely. Thank you, Walter. And as Walter mentioned, I'll be diving a little into this partnership with the government of Mozambique in responding to a natural disaster. So, as many of you know, in April and March of 2019, Mozambique was hit by two cyclones, Cyclone Idai and Cyclone Kenneth. And in the immediate aftermath of Cyclone Idai, which was the largest natural disaster to hit Mozambique in about 25 years, what we saw was a rush of partners to Mozambique to respond to the disaster. So this included various government agencies that were involved in the response, international NGOs, international organizations, and bilaterals such as CDC and WHO. Now, every single one of these entities were generating their own information source. And given this context, you can really think about how messy this gets. So in the example of health facilities, what we saw was a mixture of the use of different data collection systems. Because as you can imagine, a large number of health facilities were severely impacted by the cyclone. Being cut off from electricity and internet meant that they relied solely on Excel spreadsheets. And in many cases, we'd receive just pictures of cholera line lists over WhatsApp. So it's safe to say that we saw a lot of Excel. I think it was like about 150 Excel spreadsheets a day, if I recall. But other than this, and I just want to speak a little bit about the landscape in general as well. There was a ton of mobile data collection apps that were in use at the time, surveys that are being conducted, data sets that are coming in from the 154 makeshift treatment centers, which were previously schools and churches that were now processing patients with cholera, fever, and malaria, etc. And just to briefly also add to this list of data sources, there were also a variety of sources that were vital to the response. So these included historical malaria data. So this was used to assess trends in malaria post and pre-cyclone to quickly identify outbreaks at the lowest geographical level. Census data, which Walter also touched on during his demo, and geospatial data. So here, one example was that we integrated water source location data and layered that geospatially with cholera incidence data. So first responders could easily identify high-risk water sources for decontamination. Now, with all these data sets in mind, the idea of leveraging all these for data-driven decision-making is certainly a daunting idea. So one can imagine that each of these data sets had a different structural standard, different indicator names, and different naming conventions for geographical locations and entities that are contained in the data set. So what we did was, in the first 24 hours of landing in Mozambique, we integrated their first two most important data sets. And in a period of about 2 weeks following that, we integrated remaining 6 key data sources, and were able to serve as a central nerve center source, where all this information was fed into one place so that decision makers could have a centralized, uniform platform for decision making. The ability to consolidate all this information in one place and compare these reports and data systems side by side was ultimately what was so important for decision makers in order to determine how to drive their response effectively. So on the next slide, we have a few examples of publicly available information products that were generated through the platform during the response. So these were EPI bulletins that were produced on a regular cadence and incorporated a lot of actually all of the data systems that I previously mentioned. These reports combined with daily reports which analysts produced from the platform during that time helped coordinate partners and mount an effective data-driven response. So this was just a brief overview of our partnership with the government of Mozambique during the emergency response. There was a lot of other fascinating use cases that we worked on during that time, but I'll take a pause here and we can extend that conversation during Q&A. So I'll hand back to you, Walter.
Thank you. And you know, Safa, one of the things that I wanted to ask you about just very quickly before we go to Claire is to ask, you'd said that we were processing around 154 Excel spreadsheets a day coming in from different health facilities. And I wondered if you could talk a little bit about what the process was like in terms of integrating just Excel files galore, which is a pretty common thing that we see in emergency responses, especially.
Yeah, exactly that. I think it's a very important question because in emergency response, I think what we have is an evolution of the response itself. To touch specifically on your question around these 154 health facilities that were reporting to us, in the beginning of the response, this was all done in very different formats. So you can imagine that one health facility would record data in a certain way and another would record data in a different way. And what this required in this initial phase was a lot of intense standardization through our harmonization layer. But what made it really easy was that once we identified all the different formats that we needed to harmonize, our platform also has the ability to upload data sets and Excel data sets directly from the platform. So health facilities that had access were able to upload these data sets through the upload portal, and that would straight fall into our pipeline, which was then reflected on the platform. As time went by, we were able to really standardize these data sets across different health facilities. That really helped consolidate data a lot better. But I think the important aspect here is just having the ability to bring in any data set, such as an Excel, as rudimentary as an Excel spreadsheet, directly into the platform really quickly was really important for the response.
Great, thanks, Safa. Next, I want to turn to my colleague Claire Rivero. So we're helping countries right now in their response to COVID-19, and we're going to open the floor soon to questions. I do want to put out one disclaimer that we've agreed not to mention the specific countries, but we will be able to talk about some of the specific use cases. Claire is an epidemiologist by training. Has really been instrumental in helping us think about some of the various use cases that we need to think of as we go through the phases of the response. And Claire, I wanted to ask you, we had just heard from Safa talking a lot about how this was used in the emergency response in Mozambique last year during Cyclone Idai. Would you talk a little bit about how we're going to see COVID affecting low and middle income countries, and also high income countries as well, the various phases of the response, and how data will play an important part along each of those periods?
Yeah, absolutely. And I think we can use some of those lessons from Mozambique that Safa touched on, and I'll try to incorporate what we've learned from Mozambique and how we can leverage that into these current responses, what we're actually seeing in the COVID response already. And I'm sure everyone's had quite enough of looking at EpiCurve graphics, so please indulge me. I think the EpiCurve really helps us illustrate some core principles that helped us in Mozambique and that we can leverage as we move into the future with this COVID response. And I think there's a few things to keep in mind here. In response to COVID, in fact, response to any emergency, these responses aren't monolithic. These responses have to be dynamic, and the pace of that dynamism in our response as a community of practice needs to outpace the emergency itself. And that means our systems need to be maximally flexible and rapidly adaptable to the evolving realities and the specificity of every context and country. So again, this really core principle of flexibility, it also needs to be applied to the core principle that governments are in the driver's seat here. They govern the data, they govern the data sharing policies, they govern where the data is stored, and they need this data to inform the decisions they are making for their populations. That's their mandate, and we are here to serve and support that mandate as a full community, including Zenesis and including all the data collection companies, all the implementing partners. We're here to serve the government mandate, and we all need to do so in that maximally flexible way. We need to do so in a synergistic way. So using these core tenets of flexibility and centering on government decision-making during this time of crisis, I want to walk through these phases and talk a little bit about the use cases, the resources, and some opportunities for all of us. So first, there's this preparation phase. I'm not going to dwell on it too long because for most of the countries we serve and live in, this preparation phase, we were all woefully underprepared. I'm going to come back to preparation because it has that really important relationship with resilience. So I'll come back to preparation, but I'm going to start with when those first cases, those index cases are discovered and we're in that case containment and outbreak investigation phase. And this is when we see these nerve centers that Safa and Walter mentioned, these nerve centers or emergency operations centers. There's numerous names for them get set up. And in parallel, many implementing partners or organization, governmental bodies are collecting data. They're starting their data collection process. And the critical thing is whatever we call that nerve center, whatever we call and name that decision-making body, there needs to be a central source of truth that allows the government to run daily, maybe even more frequently than daily, epidemiological briefings for all of us involved in the response. And those briefings need to include the validated data from all the data sources available to them. Everyone in these crises needs to be singing from the same sheet of music. And the integration of all of this data into a central source, it needs to inform a few really critical policy and action questions, including where are the cases, where are the case contacts, and are there resources in these specific areas to respond to containment, morbidity, mortality. And data source is really critical at this phase, our laboratory line lists, case tracking line lists. And again, as Safa said, we're seeing these in Excel. Sometimes Excel is the fastest way to start collecting data, but then we see some evolution. We're already seeing this moving into more mature digital data collection. And we need to be able to marry that. We need to be able to look at the historical data sets alongside our new digital data collection. So integrating those historical Excel sheets with the new digital data tools. And I think one thing we've seen right now, one thing that we're working with governments in this phase as they're trying to do case containment is do a rapid assessment of where ventilators are and be able to map those ventilators against that case containment data. So then as we move into this next phase, and sadly, I think we've all seen many of the places we work and live move into this next phase, hopefully nerve centers are set up and we move into this coordinated response to community transmission. And this is when community transmission, just I'm sure everybody knows, but just so that we're level setting here, it's when every positive case, COVID case, cannot be directly linked back to another positive case. So individuals are contracting disease just from being in their environment. And often we see community transmission trigger these policies like social distancing. And again, we need that central source of truth that's adapting to the new data sources that inform interventions or policies like social distancing. It needs to incorporate, maybe there's multiple digital data collection systems now, and we need to scale that triangulation of analysis to commodity data, mapping the movement of commodities and populations out of high transmission areas. A few examples of how we're seeing this phase and the data systems in this phase inform the response. I'm going to talk about Mozambique, and then I'll talk about some examples we're seeing in the COVID response. In Mozambique, when we saw scaled transmission of cholera happening, we helped the government map water source point data with the cholera contacts, the cholera infections. And that helped the government direct action to high transmission areas where we could be reasonably confident there was a water point where individuals are being exposed. And again, so that was the water point data source mapping to the disease burden data sources. And then I think one thing that Safa touched on was the clear public health communication. I think we can all speak if we all wake up and we're looking at these epi curves for our given country or the places we work where our loved ones are. Clear public health communication, that these governments need a central source of truth where they can rapidly report out to the public or the press. And in the case of Mozambique, there were epidemiological bulletins being regularly reported out. And I think Safa breezed through it, but getting 154 daily Excel data sheets integrated and validated for a public briefing of the disease on a daily was enormous, and I think we're very proud to have served the public information and the information being shared with other implementing partners. And that's really critical right now and something we're certainly going to see as we move into the COVID response. So again, just as we stay in this phase, a couple things that we're seeing specifically in coordinated response for community transmission, as countries begin to implement these social distancing measures, we're seeing call centers being set up, and you need to match that call center screening data where people are calling in with their symptoms to your line lists, to your testing data. We see the need for dynamic mapping of facilities. So nationwide, what is our master facility list? How are we dynamically mapping new facilities, buildings that are being converted into health service facilities, as well as quarantine points? All this needs to be rapidly added to the master list of facilities and immediately available for triangulation of data on commodities, medical equipment availability, and human resource availability. So finally, we get to these final phases of recovery and resilience. And I know it's hard to conceptualize a point that we will all be there, but I'm holding quite precious this memory from Mozambique, where we were able to help inform a vaccination campaign in response to the cholera epidemic. And we were able to help the government rapidly assess where do we need to get these vaccines the fastest. And obviously, this is not an immediate use case, and we are months, if not years away. But I think that we can apply interventions like monitoring of experimental treatment delivery. Where do we need to experiment with treatment delivery the fastest? Where do we need to be tracking reinfection rates and preparing for seasonal surges of COVID? An important point in recovery is also monitoring the impact of this emergency on the service delivery for other programs. We're already hearing from governments about the need, as Walter touched on briefly, to think about food security, to think about malaria. And this is going to be particularly important to be prepared to answer critical questions about the concentric circles around this response as we move into that recovery and resilience phase. And a final word on resilience, as I mentioned, this has this important relationship with preparation, and I think it's hard to even think about preparation for another outbreak when we're in the fog of war, of just responding right now, and we're on the upswing of this epi curve. But I think if we go back to those guiding principles and we think about flexibility, that synergy in rapidly adapting to the evolving needs, the evolving data sources that are available to inform government decision-making. Those initial principles, I think we can both react to the current situation and simultaneously shore up these systems so that when we do see a resurgence of COVID and or other infectious disease, that we're better equipped as a community of practice to support the government response. Back to you, Walter.
Yeah, Claire, I was wondering, we talk about the ability to stand up a platform that can integrate various information systems very quickly. I would be interested to hear if you could talk about a use case that we're seeing with COVID potentially, where within 24 to 48 hours, what's a concrete type of use case where we've been able to support a government within that kind of time frame, just to give a sense of what's possible.
Absolutely. So I think I've touched on pieces of this, but I'll give you sort of the storyline of one response right now. There was an incomplete incomplete facility list that lacked geographic data points and did not currently incorporate the new facilities and quarantine points. So the first step was helping the government rapidly update the master facility list. So they had a sense of where can people get care. Simultaneously, they have a lab list and some case line lists of data. They need to map the locations of those cases to that newly updated facility list. So that mapping is done. And then on top of that, that third layer was where are ventilators? And they had a general sense of across a few of these hospitals, we think there's this number of ventilators. So we mapped the ventilator data to that new updated master facility list. And then we mapped that master facility list to that line list data to give us a full picture of the initial question of where are these critical cases, and do we have some resources to keep people alive in the places where we're seeing high transmission.
Great. Well, thanks very much. I do want to pass it off to Tenley to facilitate a question and answer period. Before I do, I do want to mention just a few things. First is, we do want to work with other implementing partners as well as directly with governments. So if you, are one of those two types of entities, please visit us online and go to medium.com/Genesis as well, which is where we have a specific COVID-19 response page. And there's actually a Work With Us tab that you can fill out, and we'll make sure to get back to you within 24 hours. There you can also find out information about the $1 million matching funds. But a few things that I wanted to mention before question and answers, just because I can see in the chat some of the questions that have come up. The first is that we want to strengthen and complement existing investments, investing in existing systems. The goal here is not, the goal here is, let me rephrase it this way. The goal is to strengthen the capacity of all systems to come together, to work together. And every system, every investment that's already being made is a valuable one. So we really want to see scale-ups of systems like DHIS2, for example, and expansions of DHIS2 modules. We think that's very important because it provides this structured data system that has uniform indicators. It's really important to be using standards where that's possible. And we want to encourage governments not to abandon existing investments in standards and systems that are capturing information in a systemized way. What we want to do is to amplify all of that work by bringing together the whole ecosystem of additional systems that are not readily available within the modules, for example. So if you've got proprietary supply chain systems, all of these other Excel systems, all of these web-based contact tools, et cetera, we want to be able to enable governments to bring all of that data, not to mention all of the other sector information. So agricultural data, transportation information, finance and labor and employment information, education information. We want to be able to give governments all of that, access to all of that information. The other thing is that we know that many providers, many governments, many organizations have already made investments and have spent a lot of time on learning how to use other visualization tools. That's really fine. We've spent a lot of time building our visualization tools such that they are uniquely suited to help address many of the use cases that we see in government response to a variety of use cases. And we also are highly iterative in the way that we respond to requests. So if somebody says, I need a visualization that does this, we'll go out and build that visualization. Having said that, though, we know that there are other tools out there. And what we can do is also serve as this tool that serves in the background to integrate all these different information sources. We then can make the integrated data available via an API so that you can actually access that data via other visualization tools as well. Or for really sophisticated modeling that goes on for specific disease areas, for example, we can serve that information to those modeling software via this API tool so that you can actually use us to integrate the information from a variety of different sources and then use other tools to then perform modeling on top of some of the other modeling tools that we have that we actually didn't get into on this particular discussion. And then one of the last question that I wanted to address is just we've done both cloud-based as well as cloud-based deployments as well as deployments on national data centers. Because of our experience working in more than 10 countries across different continents, we have experience seeing a whole variety of the different ways that data governance laws are structured, and in each case have implemented the platform in a way that conforms to those rules. So in places where we can do a cloud-based deployment, we've done that. In places where we've had to do deployments on the national data centers or on in-country servers, we've done that too. And this is not to say that software alone is going to be the panacea that can solve all things. User engagement is also very important and a huge piece of this. Data-driven decision-making happens with the users of that data. This is one component, an important component, but not the only solution as well. I just wanted to draw that point out and wanted to pass it to Tenley now.
Thanks, Walter. Yeah, we've had a lot of great questions come in the chat. And if we have a couple minutes at the end, we can open up for verbal questions as well. Walter, I think one thing that a couple people have raised is, could you talk just a little bit about the science behind the harmonization and ingestion integration of these data sources? I think we talked about the fact that they're brought in and the great things that can be done by querying and viewing that data in one place. But can you talk just a little bit about how we solve different definitions of indicators, administrative unit names, different individuals? Can you just talk a little bit about that harmonization process?
Sure. Before I do that, I just want to make sure, because I know Ian Webster at one point had said, who's our CTO, was going to be on the line. Is that the case, Tenley?
Yeah, Ian is on as well.
So maybe rather than me answering the question, it would be better to pass it over to our Chief Technology Officer, Ian, who, his background prior to working with Zenesys worked with Google, NASA, and has an illustrious technology background.
Ian, you're allowed to talk if you need to. There you go.
Okay, great, thanks. So how can I help? Can you repeat the question?
Yeah, the question was just, can you talk a little bit more about the science behind what happens when these different siloed data sources are ingested, what the process is for harmonizing and cleaning those data sources when there's differences in administrative hierarchies, individual names, facility names, things like that.
Yeah, absolutely. So what we've done is we've built a kind of a typical ETL pipeline. So that's a extract, transform, and load pipeline that's particularly geared toward harmonizing differences between different data systems. Aside from the usual cleaning and normalization that you would have to perform in order to ingest healthcare system data sources, we also have a handful of data science techniques that we apply in order to match up these disparate data sets. So a really good example of this would be in many countries, we collect different data sets, but we find that they use different administrative hierarchies. In many countries, names are transliterated from different languages or local languages and are not consistent between data sets. We use techniques like fuzzy matching, edit distance, different ways that we can come up with scores for potential matches and review those scores in order to determine the best resolution for these entities. We also apply heuristics based on local languages, naming conventions, that kind of thing, in order to come up with the best match. Another thing that I would mention is that we also apply some techniques that deal with tree-like data structures in order to make sure that these administrative hierarchies are merged appropriately. And in many cases, the same logic applies to other matching problems between data systems. So another kind of adjacent area is indicator matching and trying to cluster indicators together in order to figure out which ones are reporting the same data, how do we transform data between indicators, and so on.
Great, thanks. I also want to add that nothing we do is in a vacuum either. And so we work side by side with the end users to make sure that every data that we end up integrating and then surfacing ultimately in the platform is validated to match the underlying subsystem data as well. So that there's a very important data integration step that happens, but I'd say also an equally important data validation step that we perform with the end users and implementers of the platform.
Yeah, Walter, and I would add that we have an interface that allows the end users of the platform to validate these matches, which are programmatically generated. So there's always a way to confirm.
Yeah.
That's great. We've also answered quite a few of the questions in the chat. We're getting close to the end of our time. So I just asked the panelists, Walter, Claire, if there's any last words that you'd like to share about our implementation model or how we treat client data. I think those are a couple questions that come up quite often. Just data security and the way that Zenesys implements our projects. I think that might be a welcome just way to wrap up the call.
Sure. So I think, the data security, data governance, privacy, these are all, the very first questions that we ask when we are beginning a project. And so at the very outset of a project, there's a certain legal aspect of this and governance aspect of this where we very clearly determine with the counterpart. So imagine a Ministry of Health what are the specific data sources, data indicators, et cetera, that they want to have integrated and that they're willing to share. And so we have a formal data sharing agreement that's often put in place that governs these issues, governs how data can be stored, where it should be stored, et cetera. On specific concerns around things like, and that I want to add that gets into many countries have laws, for instance, that say that all of our data must stay in the country on our servers, for example. And in those instances, we'll do a deployment at the national data center. With respect to use cases where we have individual level data, I think there's a number of things that are important here. One is that within the platform itself, you can set administrative rules such that some people can have access to individual level data, perhaps, but only other people can only have access to aggregated data. Or maybe only some people can't actually interact with the data itself. They can only interact with the dashboards. And you can create user permissions so that people who have a need to know can access some information, but people who don't have a need to know can't access all information. And there's an administrative tool that allows you to go and modify user permissions as needed. And so that's one way that we can enhance trust and confidence in the data. And we apply the same kinds of encryption and data security standards to the way that data moves between the various processes, from integration, harmonization, output to visualization software, that is the same across the same that's used by banks and other entities that are dealing with highly sensitive data and need to ensure highly secure encryption protocols. Did I address the points there, Tenley?
Yeah, I think that was great, Walter. So we're at time right now. I know our panelists are happy to stay on and answer a couple more questions if there are questions for SAFA around the Mozambique emergency response work that we did in 2019. Yeah, if there are any remaining questions, we're happy to stay on for a few extra minutes and answer those. Otherwise, it seems like things are wrapping up. So Walter, if you could just move to the last slide. Thanks. So I just wanted to thank everyone for joining today. This has been a great webinar, and we really appreciate our panelists' time. We do have a number of resources on our Medium blog, the medium.com/Zenesis. And if you visit the Work With Us page, you'll see there's a link to the registration form that Walter mentioned. This is a registration form to indicate your interest in the matching funds that Walter mentioned earlier. You can also write directly to us at COVID-19response@zenesis.com. If you have a COVID response specific question, you can also write to info@zenesis.com if you just have more general questions. I've also listed our panelists' individual email addresses. If you have follow-up questions for Claire, Walter, or Safa, they'd be more than happy to answer those. And so thank you for joining today. We really appreciate your time, and we look forward to hearing from you.